So we come across patients who have a history of repeated abortions. They come with 2 abortions or 3 miscarriages. So those patients, they come under the category of recurrent miscarriages. Now, what could be the reason for these miscarriages? It can be the hormonal, maybe the deficiency of progesterone hormone, which is important to sustain the pregnancy, or there can be some medical disorders like thyroid, maybe hypothyroidism, maybe uncontrolled diabetes, uncontrolled hypertension, or in cases like polycystic ovarian disease. This can also be seen in certain autoimmune conditions where the immunity factor may be there, or in cases like thrombophilia cases where there is a clotting disorders. Then most important group where there is a recurrent history of miscarriages is the genetic. There may be problem at the genetic level in the embryos or the chromosomal disorders. So these are few important causes for recurrent miscarriages. So whenever the patient has the history of these miscarriages, recurrent 2 to 3 abortions, consecutive abortions, they should immediately see their doctor so that the cause can be ruled out and we can save the pregnancy. If it is just because of the hormonal disorders or related to some medical conditions, those medical conditions need to be treated or to be stabilized before the patient gets pregnant. The hormonal deficiency like progesterone can be taken care of in very early pregnancy. So these are the important things. Regarding the genetic causes, we can do the karyotyping of both the partners. And if the karyotyping comes out to be normal, then another important thing is to go for IVF, where the genetic testing of the embryo, which we called as PGT-A, that is pre-genetic implantation testing of the embryos, to rule out if the embryos are genetically normal or they are genetically abnormal before placing them into the uterus. If the report says that out of 3 or 4 embryos which have been created by IVF or ICSI cycle, the embryos, like out of 4, the 2 are normal or 3 are normal or only 1 is normal, genetically healthy, then only that particular embryo will be transferred into the womb so that it carries well and the pregnancy is safe. So these are the few reasons why common conditions where the miscarriages happens and how they can be prevented, it is important. So don't ignore it. When you have the history, please see the doctor and consult to rule out the causes and how the pregnancy can be saved.